Hi, I'm Susie Morgan, founder and director of training at Precision EMDR Academy, and I am with Danielle Ciccone today, and I'm super excited about this. She is one of our assisting faculty at Precision EMDR, and she is an expert in ketamine-assisted psychotherapy and specifically has developed a really incredible protocol about how to synthesize and optimize really the combination in order to really allow for memory reconsolidation to be optimal for both EMDR and the use of ketamine. So I am sure that I'm not explaining that as clearly as she could, but I really want to just entice you to stay because this is a really exciting conversation because I think she is one step ahead even of the field in this. And so I'm very privileged to have her be a part of our team. And so I'd like you to be able to get to know her and her work. So today, what we're going to cover is just who she is, but specifically her story with this, like why this became so important to develop and to create and to optimize. And then also what were her major moments along the way, essentially, in really understanding the importance, but also getting to a point where there's a sense of like, we've nailed it. We've nailed something really important here. And then also, what's her story with Precision EMDR and why us? What made her want to join our team and be a part of what we're doing? So let's get started. So, first of all, Danielle, tell us a little bit about you.
Okay, well, thank you. I'm really excited about this. So yeah, I'm Danielle Ciccone, and I'm located in Thousand Oaks, California, so Southern California, Ventura County, but pretty close to Los Angeles area where I grew up. I'm a licensed professional clinical counselor here in California, and I've been practicing for about, gosh, 12 years now, if I'm doing the math right, something like that. And I got trained in EMDR in 2019, and that was really kind of my first like major training that I did after, grad school and getting licensed. And ever since, it's been my main jam. I just like fell in love with it right away. And so I think it was shortly after I got certified in EMDR, I started to pursue like training in CAP and psychedelic-assisted psychotherapy. And so I went through the year-long program, which was very comprehensive at Integrative Psychiatry Institute, IPI, and was just like super fascinated by it. And so yeah, pretty quickly started to kind of play around with putting the two of them together, EMDR and CAP. Um, and eventually figured out a good way to pair the two. So yeah, that's been like the bulk of my interest for what's it been now? About 3-ish years, 3 or 4 years. Has That's where my focus has really been. Um, I also got trained in IFS during that time, so that has also kind of been, part of what I weave in as sort of an extra tool. Um, so yeah, and then got the privilege to join your team sometime last year, I think it was. Yeah, about a year ago. Um, and was just, super excited to join and be part of that. I really wanted like a team to be part of, um, a team of like, you know, smart, curious people that were really dedicated to doing this well. So that's been really, really fun. Um, I'm sure there's lots more I could say, but hopefully that's a nice little introduction.
I appreciate that. And we'll dive into to the joy of having you as part of our team in at the end, but let's start back at the beginning. So specifically your curiosity and the interest in working with psychedelics and that whole world. So what is the story behind that becoming really important to
Mhm.
you? And is there a moment in time? Is there a specific type of experience that happened that made that really like, this really matters that you can point to?
Well, actually, it goes way back. So I'll tell you the short version. So my interest in psychedelics actually to be totally honest, happened kind of randomly when I was really young. Um, kind of stumbled upon psilocybin and had like an incredibly powerful mystical experience and didn't know what the heck happened, didn't really know that it could be used therapeutically, just kind of like tucked it away as like this incredible life experience that I didn't really know what to do with. And then, like probably 10 years after that, I actually, when I was at a conference presenting some research when I was in grad school, and I stumbled into a talk by a guy named Roland Griffiths, who I didn't know who he was at the time, but he turned out to be like one of the biggest psychedelic researchers. And he was giving a talk about psilocybin-assisted therapy. And I was like, I didn't know that was a thing, right? I had my personal experience and I knew that it was incredibly meaningful. And then he was talking about the research that he was doing and how it was, being studied to be used like therapeutically. And so that was like 2013. So that kind of put a little, just kind of tucked that away. I at the time I thought I was going to become a PhD researcher. I actually wasn't sure I was going to become a therapist. I was really, really interested in research at the time. So, tucked that away, kind of knew that that was going on. He was at Johns Hopkins. Went about my life, completed grad school, actually decided to become a therapist. So I kind of sort of left the research world and got more into the clinical world. And like I said, EMDR became the modality that I used pretty early on in my work as a therapist. And then I forget how it even came into my awareness, to be honest with you. I think some somebody reached out to me about ketamine, or it somehow came into my awareness that ketamine was also being used um, therapeutically, which I had no idea about. So I started to look into that and realized, okay, similarly to how psilocybin was being used, that ketamine was being used in a similar way. And so I just started to totally dive in, just read the books that I could find, read the research that I could find, found a company that would kind of help set me up so that my clients could be prescribed the medicine because I didn't know where the heck to start with that. And at the time, there was like nobody that I knew practicing this. I mean, I'm in California, so I know it was happening somewhere, but it wasn't that well known at the time like it is now, right? This was, I think, early 2022. And so, like in my community here, nobody was practicing CAP. I didn't know what the heck it was. So anyway, I just kind of dove into it and and just started offering it to my clients. I mean, it really was just kind of like, okay, let's see what this is all about. I mean, the research was really compelling. What I was reading about it was really interesting, and it was like, this seems like a really good, thing to offer to people.
Let me ask a question here because
Yeah.
I think there's this piece that matters with ketamine assisted psychotherapy in the idea of what's the difference between just using this recreationally,
Mm.
technically illegally,
Yes.
versus using it in a psychotherapeutic setting. What were you learning was the difference there and that sort of mechanism of action that was saying like this actually makes a difference
Mm.
with people's mental health.
Yeah.
Otherwise, we'd have a bunch of people
Yeah.
using recreationally and they'd be great. They wouldn't
Yeah.
need therapy anymore. So I
Exactly.
want you to paint a little bit of a picture about what was compelling for you in
Yes.
what you were reading and connect that to then what you were seeing in your office as you were starting to implement this.
Okay. Yeah. Because I'll be honest with you, when I first heard about it, I mean, I had the same thought. Well, if this is so therapeutic, then how come people who are using it recreationally aren't reporting all these wonderful benefits? And I mean, really what it comes down to is what we call set and setting, right? So what is the mindset going into it? What's the intention, right? Is there intention or is it just I want to party and I want to, like have a kind of an experience, but not a therapeutic experience? So, kind of the mindset, the intention, the why, and then the where and with who, makes a huge difference. Also, the dosing and the method of administration. So, somebody just kind of using it recreationally is not probably not paying very much close attention to the dose. And, depending on how they're taking it, that's going to affect them differently than how it's used therapeutically with kind of precise dosing and you know um, intention around that. So yeah, I mean, I think that's basically what it comes down to is what is the reason for taking it, what's the setting, what's the support, right? And I really think of it as like when you're using it therapeutically, you're trying to go in to kind of explore, right? To be with whatever is happening inside. And my guess, I mean, I don't know, to be honest, I haven't really spoken to anybody that uses ketamine recreationally, but I think it's the exact opposite when people are using it, or especially if they're abusing it, right? Like the intention there is to kind of check out, right? Like it's not about going in and resolving trauma. It's not about exploring, the inner world. I think it's about actually trying to escape, right? Or just have fun, right? Like just kind of party. So it's such an interesting drug, medicine, whatever word you want to use, because depending on the setting, depending on the intention, depending on how it's being used, you can have such wildly different effects. So yeah, I think when I realized, okay, well, we can use this in a very specific way, in a very intentional way, in a very controlled way, in a very safe way, okay, then it can actually be very like healing. So does that,
What about the piece with the processing piece? The as the person comes through the journey and is in this point where typically in CAP, if I'm understanding correctly, there's a therapeutic process at the end of this. So you have the set and setting, but then there's also a role of the therapist.
oh
And
yeah, absolutely.
that's a piece that I want to understand a bit because
Yeah.
as I read through some of your writings on this, specifically, we have a blog that you've written
Mhm.
to kind of go along with this conversation. There's something about that end process or that processing in the day after that is
Yeah.
potentially very powerful, but also a point where you said maybe we can do more with what we're doing with EMDR. So I wanted to understand.
Yeah, totally. Well, okay, so let me go back to what I was saying. So I mean, truthfully, I just sort of started offering CAP, not really knowing quite what to expect. And if I'm being honest, I think there there was a part of me that was kind of hoping it would sort of do the work for me and that I wouldn't really, as much as I loved EMDR, I think there was a part of me that thought, well, maybe I won't have to even do this. Maybe people will come and they'll have these journeys and they'll kind of spontaneously resolve whatever their negative beliefs are, or their traumatic memories. And so I think I had a little bit of a, naive hope about that. Because honestly, I think it was kind of how it was being sold, you know, um, for better or for worse. And so at the time, when I first started, I really wasn't bringing EMDR in much at all. Um, Although, if I think about it, probably I want to say maybe the first 3 or 4 people that I did CAP with were EMDR clients. And so that was already part of our treatment plan. And then I sort of just said, hey, you want to try this new thing, right? I think it might be helpful. And so it was sort of disjointed. It was sort of like we were doing EMDR, and then we started kind of bringing in these CAP journeys. And so the idea with CAP is, you do the preparation, you talk about what is your intention and what do you want to get out of this? And, what do you kind of want to sort of hold in mind when you go into your journey, but also kind of hold it loosely because you don't want to have too much expectation about, where you're going to go. And that felt a little awkward. It was like, let's set this intention, but don't hold on to it too tightly because we're going to just let whatever happens happen. Um, And so when I did that, it was interesting and people reported like, "Oh, this is an interesting experience." And, "Oh, I felt really relaxed," or I felt like, more open, or I could feel more self-love. I can, um, feel more hope. Like there were kind of positive things that would occur. Sometimes, honestly, it was just kind of random.
Mhm.
Sometimes there wasn't that much to take away from it. But most of the time it felt like resourcing
Mhm.
in a way, but I wasn't really seeing any kind of like spontaneous, you know, transformation happening in the journey. So then you have what's called integration, right? Which is within a couple days of the client taking the ketamine, you have a session and you talk about what came up and you talk about, what are they taking away from it. And so before I started bringing EMDR into that, honestly, those sessions just kind of felt all over the place. Like sometimes it was like, I really don't know what I got out of that. I don't really know what to even focus on. Sometimes people would have these big, like, insights, or sometimes, not often, but sometimes people would um, revisit some memory content and kind of talk about it. But it just kind of felt like, I don't quite know what to do with this, right?
Mhm.
So then I thought, okay, well, at the very least, why don't we bring EMDR into these integration sessions,
Yeah.
And I wasn't the first person who thought of that. Like people were talking about, um, there's this neuroplasticity and there's this more openness and um, it's the ability to kind of like work through things a little more easily. So I thought, okay, well, sounds like a great time to do some processing, right? And so what I started to do was to kind of sort of match the intentions of the CAP journey with sort of our intentions of EMDR, right? So if there was a certain negative cognition that we were working on, right? Like what's kind of our goal with that? That would kind of become our goal with the CAP journey. And so there was a bit of a bridge, and that was okay. And like it was kind of hit or miss. Some people seemed to benefit from having a CAP journey and then a processing session within a couple days. And maybe there was a little more, openness, a little more flexibility, a little more like kind of loosening of some of the rigid, you know, thought patterns. But it really wasn't like, it just wasn't as powerful as I thought it probably could be. Right. And so people were starting to talk about bringing them together like on the same day, but it was very loose. There was really not much direction or guidance about how to do that, right? Um, and so I sort of just started experimenting because I didn't really know what else to do. Um, and even when it was sort of messy, because I didn't quite know what to do, already I was picking up on the fact that, like, okay, there's something here, right? With a lower dose, people can still be engaged, and they can still participate in processing, EMDR processing. Um, and
So just to
yeah,
interrupt you for a second and clarify, so there's psychedelic dosing
yes,
versus psycholytic dosing. Can you
right.
explain that a bit?
Yeah,
Because
sure. Yeah.
not those aren't words that everyone knows
Yeah,
what
yeah,
that means.
totally. So, yeah, so everything I've been talking about up until this point was sort of a psychedelic approach, right? Which was really all anybody was talking about. And so that's when a person takes it's still a relatively low dose compared to like what's used in anesthesia, right? Way lower than that. But it's a high enough dose to where the person is very internal. And so typically what people will do is they'll wear an eye mask, they'll have headphones with music, they're lying down, and they're really not engaging with the therapist once they take the medicine. The therapist is there with them, right? Kind of holding the space and there to support them, but there's not much interaction. So it's very much kind of an internal journey. And it lasts for about, it depends, but let's just call it 45 minutes to an hour for most people. So that's kind of the structure of it, right? And then psycholytic is, I would say for most people, it probably ends up being about, let's say, a quarter or less of the dose that they would use for that psychedelic type of experience. And it's just meant to be kind of a softening. And they're still more oriented. They can sit up, they can speak, they can, open their eyes, they can move around, they know who they are and where they are. It's it still can sort of feel like a journey, but not in the same way that a psychedelic dose does. So psycholytic is meant to just sort of soften the person, but allow them to engage more with the therapist or in whatever, modality that they're using. And actually it was with LSD, very small doses of LSD back in like the 50s. That's how that approach was initially developed. So,
Interesting.
I believe they were pairing it with psychoanalysis. So it's actually a pretty old, you know, idea. Um, so I hope that clarifies the differences between those two approaches.
What I'm hearing in that orientation difference is this idea with EMDR therapy, we use the language of, having one foot in the past, one foot in the present.
Yeah.
And it sounds like with a full journey at a psychedelic level, you
Mhm.
really don't have a foot in the present.
Not
And
really.
so it seems like some of the pieces of what's necessary for EMDR to be effective, if
Hmm.
someone is engaging in more of a psychedelic level of dosing, you're maybe inhibiting some of the efficacy of EMDR.
Hmm.
If you're still trying to provide an EMDR intervention kind of
Oh
same
yeah,
day or simultaneously. And
that doesn't work very well in my experience.
okay.
Well, because and also, so yes, the person can, not always, but with a psychedelic dose, the person can kind of lose touch with, I know it sounds kind of funny, but like who they are, where they are, they can actually kind of lose their ability to speak. Most people still find it very pleasant, but it's really not, yeah, you're not oriented, right? And also like those journeys, they're very open-ended. It's go wherever you go. It's really not targeted, right? So, so I started to hear about people. So, okay, so originally everybody, well, not everybody, but the few people that I heard talking about it would say do the reprocessing a couple days after the journey. So, as I mentioned, played around with that. It was kind of hit or miss. Then there was the idea of, try to do a little bit of EMDR on the tail end of the ketamine experience. I tried that a little bit, and that kind of got really wonky, because people were usually tired and it made the session really long to try to do some reprocessing after they just went through this big long journey. And so that just never really stuck and never really worked well for me personally in my practice. Um, so then again, I started to kind of hear about this idea of psycholytic. So like I said, I was just kind of playing around with it. I didn't quite know what the right timing was, but um, I started to just see what are people capable of on this smaller dose. Can they do processing? Are they oriented enough? Can they talk? Can they follow? Can they follow? Where do they go? And and yeah, I had a couple clients that, they had done regular EMDR with me. They had done CAP with me, just kind of the traditional journeys. And then we started to play around a little bit with this psycholytic EMDR with ketamine. And they were like, yeah, there's something to this, right? Like yeah, I can still do the EMDR, and I can hold a target and I can kind of move through it and they were oriented enough. And I had a couple people in particular that I'm remembering that, the target that we were working on was something we got kind of kind of stuck on with standard EMDR. They were just really hard things to move through, and I remember um, being able to move through that much more easily. So, so yeah, that I kind of decided at that point, okay, I think this is the way I want to work with these two tools, but I still wasn't 100% sure on how, um, or what exactly was going to work the best. And so, um, is it okay if I kind of switch now into like sort of how that process came to be? It really
Absolutely.
was kind of stumbling around a little bit in the beginning and no and having a sense of like there's something here, but I'm not quite sure how.
Yeah.
Um I sort of got how do I want to put this? I not that I gave up on the other methods, but I was like, okay, no, I'm really want to figure this psycholytic thing out. This seems to be where the magic really is. Um, and so luckily, I ended up meeting Michele Topel, who is who I've, collaborated with on this. And she was kind of experiencing the same thing. Interestingly, we were sort of on a similar timeline in terms of, when we learned about the different tools. And she was also playing around with it in her practice, and she was starting to see some interesting things. And so we said, let's just put our heads together and figure out the best way to do this because what's out there so far is sort of loose. It's sort of ambiguous. It's sort of unclear. No one really knew. We were all just, trying to figure it out. Um, and so we started to actually look to see if there was any research on ketamine and memory reconsolidation. At the time, I was reading a lot of Bruce Ecker's work on memory reconsolidation, which I'm just super, super fascinated by. And so we're like, let's dig in. Maybe there's a clue in the research, and maybe we don't have to just guess, right? And started to just read tons of papers, and it started to make sense that the timing really did matter. The timing of when the person self-administered the ketamine, because the way that I do it, it's all self-administered. There's no medical professional there. It's not an IV. It's all sublingual.
But
So
it is prescribed.
it
I
is
just want to
prescribed.
it is prescribed.
Absolutely. It is prescribed. They just don't have to be in, the medical person doesn't have to be in the room
Mm,
because the client can self-administer it. So what became really, really clear from reading the research is that the timing did matter, you know. And so we were able to kind of nail that part. And so when we figured that out and we got really clear with our kind of protocol and we started to apply that with our clients, then what sort of felt like kind of messy but still good,
mm,
became this sort of like precise, clear method that actually had some good reasoning behind it. And it seemed to become more effective. Um, so really, I mean, it was really kind of what we discovered in the research and then us collaborating um, to clarify.
mhm,
And then at the same time, I started to do my own work with it.
mhm.
Um, so I'm a person in long-term recovery. I've been sober for 12 years. And so I wasn't sure I was ever going to have personal experience with the medicine. Um, but, me personally, I felt like a, it wasn't a problem. Like it didn't compete with my recovery. In fact, I felt like it could be really helpful. And so I found a therapist who actually um, already had experience with EMDR and ketamine. She wasn't using it exactly in the same way that Michele and I were starting to develop it, but I asked her if she would take me on as a client and I could practice some of this like as a client. And that's what really that's what really sold me. Um, because up until that point it was all theoretical and it made sense. The science was there, the research was there, the theory was there, the AI, how the AIP model works and what ketamine does in the brain. It all made sense. And what I was observing in other people was sort of, affirming,
Mhm,
but it was that like experiential component
mhm.
that really made it kind of come to life, if that makes sense.
How so? What was the difference experientially? Because at this point, you've now done regular therapy, you've done EMDR therapy, all of that, and now you're experiencing this, you know, this methodology that you've created based on research, which I love, and just not being enamored that, ooh, it's this cool thing, but really being like, but it could be better, it could be
Oh
better,
yeah.
better. So then, okay, so what is that experiential difference for you?
Yeah. And I mean, I had done a lot of therapy as a client, good therapy, right? Like had great therapists and had done a lot of really good work. Um, But I am a person who is more kind of intellectualized, a little more in my head, right, when I process things. And it just kind of like drops you into this space where you can really process things on a very deep level without kind of being up in your head. And for me personally, that was huge because I think while I think I did resolve a lot of things prior, um, I think a lot of it was more cognitive,
Mhm.
you know, and this just kind of it just dropped me into a much more emotion focused, somatic, vivid, deep like space without kind of the noise
Mhm.
of the cognitive part of me. And that's, I mean, that's really what it seems to do for most
Mhm.
people. And clients would kind of tell me that, but I didn't, you know, I didn't quite know exactly what that felt like until I experienced it. Um, so yeah, I think the best way I can describe it is just the depth that it gives you and the ability to kind of stay there, right? It's almost like it kind of this probably sounds silly, but it kind of like drops you down into this world, your inner world, right? And you can just hang out there and really kind of reorganize some things,
Mhm.
kind of come back up, if that makes sense, without getting distracted or pulled away or, less defended for sure. It also made imagery a lot more vivid for me in a good way, not in a overwhelming way, but in a very helpful way. Like, for example, let's just say I was working on a childhood target. Before it was like, okay, I could think about the memory, but I couldn't quite picture it very clearly. With the ketamine assisted work, it's like I can go right there. It's interesting. So it really, um, like I said, just kind of drops you into this more vivid, deep space.
Simplistic level, what I'm hearing
Yeah.
is it's not an intellectualization experience,
Right.
it's an experiential experience.
Totally. Totally.
And so it also still sounds like that it's not sacrificing anything meaningful about EMDR in the process. It's deepening
No,
what
totally.
is meaningful about EMDR.
Absolutely. Yeah. And I mean, it still requires very specific targeting. In fact, that's what I prefer about it than any of the other methods that I've mentioned about how people combine the two. Um, you can be very targeted with what you do. Now, the associations can go all over the place, as we know,
Mhm.
but in a very meaningful way, right? In a very, actually, what's so interesting is that even though it can feel like you're going all over the place, the clarity that you feel is like very, very palpable. Um, there's just this intense sense of like clarity of, oh, okay, I see how this is connected to this, and oh, okay, like just sort of the insight and the clarity um, comes through really strongly. And so,
The following of the association
yes.
almost makes even more sense.
Yeah,
And like we're still doing that with the EMDR, like in our basic trainings,
right.
we're teaching, yes, it might go to here and there and other memories and memories you didn't think of. It might go to Donald Duck, but
Right.
just go with that. But it sounds like with this, it almost makes even more sense as you're following them that
Oh
like,
yeah.
of course
Yeah.
it's going here, of course.
Yeah. And I think when you're in the client role, instead of going, what's happening? Like, why am I going to this? And what you're just going. You're just
Okay.
going. Right. And it's
Less worrying about it.
and
Yeah.
there's a sense of, oh yeah, of course, right? Like it's so hard to put into words. It really is. And frankly, like it's a lot more fun. Like it's a lot more interesting. It's almost like it takes everything. This is going to sound so weird probably, but as if it was black and white and now it's like in full color, right? Like
Mhm.
everything's a lot more rich and a lot more like the feelings are so much more palpable. Um yeah, it's very it's so it's very interesting.
Mhm.
It really is. Like when you're in the client role and then in the therapist role, just kind of watching and tracking where the person's going. I mean, EMDR is anyway,
Mhm.
but imagine that just amplified, you know?
Yeah.
Um,
So let's transition then to the
yeah.
EMDR component, because some of our conversations about precision EMDR's appeal has been the idea that to do your protocol well, you
Mhm.
need to know EMDR well,
Yes.
and in specific things about how you do EMDR, not just the scripted protocol per se.
Right.
So tell me more about your your story behind like discovering us and what we're doing,
Mm-hmm.
but also why it feels important specifically with your work.
Okay, yeah. And I'm really glad that we're talking about this because it's really important to me now that I'm like training in this and mentoring other people that we don't lose sight of that, right? I really don't want people to get the impression that, oh, you just add a little bit of ketamine and it just kind of works itself out. Yes, it enhances, it does make things easier. It does seem to help bring adaptive information online so much more easily. But the therapist still needs to know what they're doing and why, So, like our protocol, it's really only what we've, I don't know how to put this into a verb. What we've made a protocol
Mhm.
is just, um, it's just about,
Protocolized.
yeah, what we've protocolized is just the reprocessing piece, right? Um, but everything that has to happen before that, in terms of getting to know the client and case conceptualization and treatment planning and preparation and determining readiness, that all still has to happen. In fact, it's probably even more important, right? If you're going to have somebody take a psycholytic dose, which might take them even deeper than standard EMDR processing would, it might, it, it will likely dissolve some dissociative barriers, typically in a way that feels a lot more safe to people than without ketamine. So that's a whole other conversation. But basically, my point is there still has to be like really good, phases 1 and 2, right? And then of course, all of our skills that we use in reprocessing, all of our interweaving strategies and all that, we still need to be really adept at. But what really appealed to me about what you teach is you put a lot of emphasis on treatment planning and case conceptualization and readiness. And those are things that I knew about and they were talked about in my original training, but with far less emphasis and with far less guidance and direction. And so, yeah, I think that's one of the things that appealed to me the most. There was a really clear map of how to take a complex, human being and kind of map out, okay, what are our targets? Why, right? What are the symptoms? What are the trauma memory networks? What are the targets that we're going to work on? In what order? Target sequencing and all that. How do we determine if they're actually ready to start reprocessing? So I think precision EMDR gives really clear guidance for that. And then I think the addition of the ketamine just really enhances the reprocessing phases. So I think the combination of the two, having that really precise treatment planning approach, um, and then the addition of ketamine to sort of enhance the reprocessing makes it really robust. And you, I, what we've observed in some of the people that have come through our training program is that, sometimes it's clear when people don't have really strong, um, like kind of foundational EMDR skills and they fumble a bit more through it, you know, and it's it's funny because it's usually still helpful, but you can sort of see the difference between people that have the really strong EMDR skills and then they're adding this to their tool belt versus someone who is already pretty shaky, with EMDR and then they're trying to bring this in and it just gets kind of clunky, kind of more difficult to actually see effective um, results. So yeah, the precision still has to be there. It's still really, really important. In fact, it's probably more important, I would say, if we're going to be using ketamine.
it does sound like it has the potential to get messier or
Yes.
possibly even more destabilizing if things
Yes.
go places that weren't that nervous system wasn't prepared to go.
Yeah.
So really having that solid sense of preparation and and like you said, case conceptualization, like
Right.
is
Yeah.
this person really having that adaptive information? Is that person really ready to go to these depths and consenting to go there and are we doing this in a messy way? Or are we doing it a purposeful way? Like all of that, just
Yeah.
if we're going to enhance the processing, we're also enhancing the power in some ways is what it sounds like. And so if we're using
Yes.
even more of a power tool, but in a
Exactly.
messy way, we can create more damage.
Yes.
Really.
Yep.
So, okay.
So, yes, I'm glad you said it like that. I don't want it to scare people because on the flip side, it can also really, yes, it can be more deep and more powerful, but it also really softens the process. So, there is that. Like
So
even
maybe a
though
protective factor is.
yeah, yeah.
Mhm.
But still, right? Like you still have to make sure that the person is ready to go there and wanting to go there. Michelle and I always say this particular approach is not for somebody who's not ready or wanting to do deep work. I mean, you really kind of have to have somebody who says, "Okay, I'm pretty much all in, to go wherever this is going to take me." Um, it's pretty hard to restrict the processing. I
Mhm.
mean, you could try, right, with all the ways that we typically try to restrict, but the person's just so much more open. You can imagine it's harder to restrict where they
Mhm.
go, right? So yes, I think just there's the big emphasis on treatment planning and preparation. And the therapist just has to be prepared to be able to hold a lot of stuff and pretty high intensity. Um, I would say the affect tends to be, on the whole, on average, higher.
Mhm.
Um, yeah, people's ability to kind of access affect it's higher. So I think the therapist has to be ready for that level of intensity. Um, it's an interesting thing because people will usually say things like, wow, I was able to go to places that I normally couldn't go, but it felt safe, right? It was intense, but I felt safe.
Okay.
And so that's a really common, feedback that we get.
So it's this both and. It's both safer, but you really want everyone to be ready to go there. Both the
Exactly.
therapist, the client, you need to know where you're going and why. And
Yes.
that's going to optimize that versus end up possibly in a messier place.
Yeah, totally.
Okay.
Yeah. Yeah. So like I said, I think the combination of really being able to have a solid map of where you're going to go and why and stick to that, you're really just bringing ketamine in to just enhance what you're doing. It's not replacing anything. It's not, trying to take any shortcuts. Um, so yeah, that's the one thing that I really hope people hear is that um, it's not a shortcut at all. It's not a magic bullet, you know. Yes, it can ease some things, but we don't want to skip any of the things that we would typically do to prepare somebody, you know.
Okay.
Yeah. Yeah. So I would say, you want to have the structure and then it just honestly it's really fun because it can become this very kind of creative process where you really can kind of dance, when you're in there, but without all the structure and the preparation and the strong foundational skills. It could feel like what the heck is happening. But if you've got all that, all your kind of foundational skills really solid, then it's really kind of this beautiful, like creative, honestly, it kind of feels like artistic in a way to
Mhm.
me. So you kind of talk about that, right? When you talk about baking, right? When you use your analogy of EMDR being more like baking, you've got to have those solid skills. And then this just kind of helps you be extra creative with what you can create. So
And I appreciate that because it's
yeah,
it's like it adds that extra layer of like what we might actually see on the British baking show versus what we all might create is what it sounds like. So it can take it to that next level, but you have to know what you're doing.
Yeah.
And that's a piece that I really respect about your approach as I've gone
Mm.
through your introductory training in just being like, yes, you went through that process with curiosity and with experimentation because you had to in order to try
Yeah.
to figure out what could work.
Right.
But then it comes out being very precise in saying like, okay, this is where the research shows we're
Mm.
going to most optimize memory consolidation. This is the dosing that allows us to really optimize both the ketamine effects and the EMDR effects. And then
Mm.
this is the procedure that really kind of like pinpoints that optimization versus it being messy.
Right.
And so I just really respect your process in that because I think I mean, that is parallel with mine. It's like there was a lot of experimentation over the 20 years of being an
Yeah.
EMDR therapist, of putting things together, saying there's something here. Oh, wait, I tried that. Nope, that wasn't what it was sold. And oh, that actually created a mess.
Mm.
And messes with human beings are really awful.
Yeah.
And so we have to do some of that to get to the good stuff, but then that coming to a methodology that has precision,
Mhm.
that has a repeatability to it and a
Exactly.
structure to
Yeah.
it, I think is a real gift. So
Yeah.
to the clients, but also to the therapists who can then learn from it and learn how to do it. So where can people learn more from you and Michele Topel about this in specific?
Yeah. And yeah, I just want to say again, I think I mentioned it earlier, but it really was us putting our heads together. It was like two heads were better than one, really. We kind of figured it out together. So yeah, our website, ketamine-assisted-EMDR.com, is the place to start. And we have an introductory course that's on demand. It's co-sponsored by Precision EMDR. It's a 6-hour course and it's didactic. So it goes through, the hows and the whys, and then there's a few demonstrations. Um, and some people stop there, and that's okay. But we really, really encourage people to then take our experiential training, which feels very similar to what we do in basic training with the practicum. And so, if people want to, they can opt to self-administer ketamine if they get a prescription from a medical provider, and they get to practice with each other. And we do those once or twice a month, and they are just the coolest things. I mean, we just have the most profound experiences, honestly, that happen in those day-long trainings. Um, so we really, really encourage people to follow through with that because, like I was saying with my experience, you can learn it and you can watch it and it makes sense.
Yeah.
And it's honestly not that complicated when you really get down to it. I mean, it was hard to figure it out, but now that we've figured it out, it's not that complicated. But the experience really kind of helps you see or feel what the client is going to be going through. And so, there's some people that for whatever reason won't want to self-administer ketamine, and that's perfectly fine. But for people that can and are willing to, I think it's really, really helpful. Um,
Yeah. I think that's
yeah,
so parallel to what we see in basic trainings,
yeah,
where not everybody's willing to sort of dive into the practicum experience. Like they have to attend it, but they don't have to dive in.
right.
There is something for those who do just say like, okay, let me do this.
Hmm.
They're like, oh, now I get it. Now I get it why EMDR isn't just talk therapy. It's not just the same
Exactly.
thing as what
Yeah.
I've been doing all along in my
Yeah.
therapeutic modalities. And so it sounds like it's really similar.
Oh,
It's
totally. Yeah.
once you actually have this experiential
Mm.
component, there's a sense of like, now I get it.
Yeah.
And also it gives really important empathy and experiential understanding of what the client is going to
Absolutely.
experience.
Yeah, it's been so cool to see people come through, even, consultants and even trainers that have come through our program who've been practicing EMDR forever, right? Like they have their solid EMDR skills down, but then they see what this can add and they're like blown away, So that's been really fun to see a wide range of skill level, but even the people that are very, very experienced with EMDR find it to be a useful addition. So So it's so fun. I'm just so grateful that I have the opportunity to do this, and grateful for Michelle and grateful for you and helping, make our, doing the co-sponsorship, making that available for us. So it's been really good.
Well,
Okay.
thank you for this conversation. And I really think that it's a gift to get to sit down with you and a gift to be able to share it.
Oh,
So,
thank you.
so I hope this helps people get curious and that they log in and check out what you're teaching, because I think that it sounds like one of those things that people should have in their toolbox. So,
I
uh,
hope so. Yeah.
thank you, and
Thank you, Susie.
we'll talk again soon.
Awesome. Thanks so much.